Good afternoon, everyone. My name is Maria, and I am so excited to be discussing with you all today, along with my co-host, Amelia.
Hello, listeners. I'm Amelia, and we are very honored to have Marta Yumiseva on the show with us today. Marta is a current family science Ph.D. candidate at the School of Public Health at the University of Maryland. She works with Latino immigrant youth experiences before, during, and after migration, and her ultimate goal is to link findings to mental health implications and policy. Marta, would you like to introduce yourself to our audience?
Yes, good afternoon, everybody. It's so nice to be here. Thanks for that introduction. Yeah, I'm currently a PhD candidate in the Family Science Department, currently working with Latino populations, specifically Central American immigrants here in the US, working on family separation, family reunification programs, its implications for mental health overall. And yeah, I have a master's degree from the University of Pennsylvania in human development, and I did my undergrad in Quito, Ecuador, which is the city I am from, in education and psychology.
Wow, that sounds really interesting. So thank you so much for being on our show. We're so excited to have you here. We'd also like to give a brief shout out to the other members of our group that has made this production possible. So Sai, our fact checker, our producers, Ellen and Haloni, and of course, our audio and video editors, Nagomi and Althea.
Without further ado, we'd like to start by bringing attention to a critical human rights issue, the persecution of the Rohingya Muslim minority in Myanmar in recent years.
While this group has faced discrimination since Myanmar achieved its independence in the late 1940s, the situation took a turn for the worse in 2017 when Myanmar's military, the Tamada Hau, actively participated in an ethnic cleansing campaign against the Rohingya.
Attacks were so violent that vast members of the Rohingya minority fled the country, oftentimes settling in overcrowded refugee camps in Southeast Asia. These camps often lack necessities such as sustainable sources of food and water, as well as basic health care.
These conditions, in addition to existing trauma from ethnic persecution, almost act as a perfect storm for refugees developing mental health conditions. Indeed, studies approximate that nearly 90% of Rohingya refugees in a critical Bangladesh refugee camp in the Cox's Bazar suffered from mental illness.
With that being said, this population is in dire need for mental health support. One of the most significant interventions implemented in recent years was the incorporation of mental health services in primary care settings for the refugee population.
This intervention, which served to integrate mental health into primary care in the Rohingya refugee settings in Bangladesh, was led by the UNHCR, which stands for the United Nations High Commissioner for Refugees. The UNHCR is a special agency of the United Nations founded for the purpose of leading and coordinating international efforts to protect refugees.
Because of the extreme lack of trained psychiatrists in the Rohingya refugee camps, it became necessary that many more mental health care providers were trained to treat mental illness amongst this population. However, one large barrier to doing so was the length of training required to complete a psychiatric residency for already existing doctors, which is about 3 years, and the issue is pertinent. Another trouble was the consideration of cultural standards that can prevent effective medical care, such as with the presence of stigma from medical professionals towards mental illness treatment among the Rohingya refugees.
In 2019, the UNHCR created the Mental Health Gap Action Program called the MHGAP, which served to integrate the mental health services into refugee health facilities. The MHGAP was created to improve the availability and quality of mental health services in the Rohingya refugee camps in order to allow for medical professionals and volunteers to be able to identify and manage people with mental, neurological, and substance abuse conditions. 2 to 3 medical professionals were selected from UNHCR-supported clinics close in distance to the refugee camp to be put through the MHGAP 3-day training program.
After the program was implemented in the refugee camp, the average number of mental health consultations dramatically increased, meaning that people felt more comfortable receiving mental health care. Mental health medications were also more readily available, and clinics figured out methods to effectively refer patients to specialists. In that sense, the MHGAP implementation of mental health consulting into primary care settings benefited the individual, which can also serve to benefit their surrounding community.
However, the intervention did not have such a positive impact on a larger scale. There were logistical issues identified by the UNHCR themselves in the sense of long-term availability of mental health medications, a lack of staff retention, poor road conditions that make traveling from clinics to the camp difficult, language barriers, and limited severe mental health care.
The lack of training and knowledge, along with personal bias in respects to the mental health providers, have prevented this study from being more effective and allowing patients to receive quality care. The stigma around mental health issues is a huge problem, and it impacts the resources that patients receive and need to recover.
That being said, because of the stigma, people are not getting trained sufficiently to become healthcare professionals and are not able to properly help patients who require specific resources. Moreover, the bias of mental health providers causes patients to receive inferior care and resources, which revolves around the challenges of stigma around mental health needs for the Rohingya refugee population. Now, to start off with our discussion today, Martha, we would like to ask you, do you think that implementing mental health care into primary health services is effective in reducing stigma in this community? And why or why not would you say so?
Yeah, I will definitely say it's very important to implement mental health services everywhere, especially after the pandemic. We have seen that we used to think that we don't need any intervention, but I think we all need in different levels. But yeah, especially for underrepresented populations, for refugees, immigrants, people everywhere, we all struggle one way or another. So implementing mental health services as a basic service, definitely it's going to help the population and it's going to improve the overall health of the refugees for sure.
So based
Definitely.
on your research, what other interventions do you think might be useful in this type of community?
I think specifically starting off with mental health services. So many other services can result from just implementing mental health overall. So I will say based on psychoeducation, I think that's one very important part or aspect of the mental health services. And it's also because we don't just want to target the populations that are suffering already or struggling already, but we also want to prevent. So the psychoeducational programs that can be implemented in these populations are also important, just, in general, about talking about emotions, talking about what's mental health, talking about depression, anxiety, how to early intervene, what are the early signs that we want to look for. That is very important. So psychoeducation on the one side, but we also need other services. So specifically for the immigrant populations, what are the community organizations? What are the needs? We have to ask community members about what are the needs and start to plan, to implement and to assess community-driven interventions that mainly will address the specific needs of that population. So on top of my head, I can talk about like trauma. Refugees have been exposed to different traumatic experiences. So we want to create those interventions that can help community members move beyond the past trauma and, deal with those negative experiences post-trauma. So yeah, that will be one important aspect.
Excellent. And then kind of building off of like the community, how do you think that cultural socialization influences stigma around mental health?
Culture, it all depends, but definitely we need culturally specific and respectful interventions for mental health. It's different if, there are language barriers just to access to mental health services overall. So it's very important to take into account the cultural differences and cultural characteristics of every population and try to do those interventions or like tailor those interventions to that specific population. So that's a point that we have to take into consideration whenever we're planning and trying to implement an intervention. Try to consider the cultural component.
In the future, what should the UNHCR keep in mind while training primary healthcare workers to treat people with neurological and mental health conditions?
Sorry, can you repeat the question?
Yeah, sorry. In the future, what should the UNHCR keep in mind while training primary healthcare workers to treat people with neurological and mental health conditions?
Yeah, definitely that we are dealing with people. You know, these are real people that have gone through a lot. Some of them or most of them have been through traumatic experiences, especially for women if they have been separated from their children, you know, leaving their children behind. Even, I mean, and for fathers as well. So just, you know, family disruptions overall, that can be very traumatic. The insecurity that you have while crossing the borders or while being a refugee, you know, trying to adapt to the new country. All of those things are just very, very traumatic. So, so healthcare providers should definitely have the knowledge that you're dealing with people, that you're dealing with real problems, that you're dealing with their emotions. Try to be, you know, as empathetic as possible with this population, and yeah, just consider that you can really do something good for these people. And you know, just try to do their best. Try to also address their needs, but in a way that's, you know, accounting for their culture, and also being able to delegate the work. Meaning, if you know, some of these people might have traumas, then you can refer them to that specific help, whereas maybe younger people can go to other psychoeducational interventions, for example.
Got it. That's a really good response. So I was also wondering, like, in terms of the work that you've done so far, what kind of experiences have you encountered in terms of mental health stigma? Because there's a lot of stigma in this community. And in those cases, how did you resolve that tension?
Yeah, there is a lot of stigma. I think, especially after the pandemic globally, now we're talking more about mental health. Mental health has always been there, but it was just a topic that hasn't been really spoken. And I think it's because of the lack of information and the lack of communication between family members, between community members. You know, we tend to talk about our health overall, whereas you have an illness or not. And mental health illnesses were just not considered an illness. And I think the stigma, it's definitely out there. It is still out there, but I think after the pandemic, now mental health has a voice and it's everywhere. And yeah, it is you know, very important to talk about it, talk about, you know, emotions, talk about and also use the correct terminology. You know, you have to label things. You have to start talking about emotions, positive emotions, negative emotions, resilience, trauma, excuse me. So that is very, very important post-pandemic, especially.
Yes, thank you. And how can a country best address mental health needs if their primary healthcare system itself needs more funding or resources or people?
That's a global problem. I think it happens everywhere, especially when, you know, we're dealing with large numbers of refugees or immigrants that are moving along. So it's very important. I can talk from the research that, you know, as researchers we just want to voice out what the needs are, what the situation is specifically for these populations, and hopefully, you know, the authorities will read our work, will listen to the needs, and hopefully we'll send out more funding. But the more we talk about it, the more that we put it out there. Now using the social media platforms really help. It's all about voicing, you know, the information that we have. And the more the information is out there, the more, you know, authorities will get the message and hopefully invest a little more. Not just on, you know, basic services such as food and housing, which of course are basic services, but mental health and health in general.
Got it. And then kind of like related to that, how should the UNHCR go about recruiting more community health workers, and how should they incentivize them to keep working in these environments? Because that was the main issue in the intervention?
Yeah, I think it's all about, providing training. There's a need. There are services that need to be provided to the population. So definitely, try to train them as much as possible to do more interventions, to talk more about mental health, give them access, to technology, to workbooks, to workshops. So the more you can invest in training, the more these community helpers or healthcare providers, the more knowledge they're going to gain, and as a consequence, they're going to be able to help others. But yeah, recruitment is definitely hard. We have seen that not everybody, is ready to listen, ready to help. We all have our own issues, so that's something that we should account for. But definitely, the foundation will be that we can do something good. We can help other community members, and if we gain that knowledge, if we train ourselves, if we really want to do something good, then that's one way of contributing.
So definitely providing more resources for the workers.
Yes, and of course,
that's like
talking about compensation as well. You have to compensate them. This is a job.
Yes, of course.
A compensation.
Yeah. Well, yeah, I think we can say that's a very complicated issue to work with. But I think what the UNHCR is it's a really great start. But just as a summary, and thank you so much, you all, for tuning in to hear our discussion with Martha surrounding the mental health interventions and implications related to the migration of youth immigrants.
Destigmatizing mental health truly is a global struggle. Even here at UMD, many groups struggle to find resources to get access to help they need. Many students struggle to take their mental health seriously, prioritizing studies over their mental health. It's incredibly important for us to be empathetic with the Rohingya, patients and health workers alike, and understand the stigma in order to destigmatize mental health using culturally competent tactics.
With that being said, Martha, would you like to share any last words or takeaways?
Yeah, I think it's great what you're doing. You're basing your work on research, and that is very important to voice what this particular community of the Rohingya are, what their needs are, what their struggles are, and one way to destigmatize is definitely to voice it out. And I think you're doing a great job by doing this. Also, it's important to not just target those who are facing difficulties or struggle with trauma or any other illness, but also create interventions that can educate with the aim of preventing all of these illnesses. And we can definitely do a lot with our emotions. We can work on our mental health. We can learn how to meditate. We can learn how to openly talk about our emotions, especially with young children. There's a lot of things that can be done. So instead of using your hands, you can use your words, for example, and that's something that we have seen that's a skill that you can learn very early on. So that the more that you invest in the early years, the better in the long term. So hopefully not just interventions targeting those who are suffering, but also preventing is important. That would be the takeaway.
Thank you for saying that. And thank you for being our guest today. And thank you to our audience for listening. And be sure to look into Martha's work as part of the Galapagos Education and Research Alliance.